Hi, everyone. Welcome and thank you for attending the NAN Project presentation of Ask, Listen, and Get Help, responding to students in crisis during COVID-19. The NAN Project is an initiative dedicated to empowering both students and educators to have an open, safe conversation about mental health struggles, to recognize the warning signs and risks of suicide, and how to help yourself or a friend who may be struggling with a mental health issue. My name is Donna Kosick, and I'm the clinical director of the NAN Project, and I'd like to introduce you to our co-trainers today, Lizzie and Shilpa.
Hi everyone, my name is Shilpa Thirukovalur and I'm a peer coordinator at the NAN Project.
And hello, I'm Lizzie McClellan. I'm the senior peer coordinator for the NAN Project. So right now we're not able to have the same conversations around mental health and suicide prevention that we'd normally be having in your community or in your school, but we'd still like to empower you to help students that you notice might be struggling. We're not expecting or intending anyone to leave this video and be ready to offer counseling or crisis services. And we're also not trying to add one more thing to your plate. We just want to bring another level of awareness to the important work that you're already doing. Our usual suicide prevention training goes more into suicide risk factors and warning signs, but this video will focus on strategies for checking in with a student that you notice might be struggling. For more information on suicide risk factors and warning signs to look out for during COVID-19, watch our other video, Suicide Risk Factors and Warning Signs, What to Look Out For During COVID-19. The link is on screen now.
We are offering the Ask, Listen, and Get Help framework as a tool for suicide prevention. You can use these steps to help a student who may be thinking about suicide. You don't need to be a clinician or a mental health professional to use this tool. This isn't therapy or mental health treatment. This is instead a way to get students the support they need and connect them to the appropriate resources.
But how do we start the conversation, especially during COVID-19, where everything is remote learning, remote conversations? We want to offer you some tips that may make that a little bit easier. The first thing you have to do is prepare yourself. As when you enter an airplane, the flight attendant says, put the oxygen mask on yourself before anyone else. So the first thing you want to do is prepare yourself with some space to have the conversation. And here are a few things to consider. You want to be in a private setting as well as your student be in a private setting. We know from our Zoom classroom work, Google Classroom, that we are in competition with whatever's going on in the house behind the student. We hear kids watching TV, brothers and sisters fighting. Encourage your student to go to a private setting because they may well be telling you things that they don't want the rest of their family to hear. So it's important that a private setting can be established. Another cue would be give your students your full attention. Give eye contact. Lean in. Your body language is telling the student that you're caring for what they're about to say and you are open and ready to listen. Make sure that you use verbal cues. Nod, say yes, I understand, or a clarifying question. Give the student your full attention. Another important point would be prepared for what your student has to say. Have your resource numbers available. Have your school policy phone numbers available. Make sure that you don't have to say, oh, give me a minute and look for those. Before you start the conversation, let's have them at the ready. And lastly, you want to give yourself enough time. Here's your student who's opening up to you. They know you, you know them. It would be the same as if you were in your classroom. So give them the time that the student deserves. Don't be rushed and put your all into asking, listening, and getting help for your students. It's not so much about what you say or you don't say. It's that you ask with curiosity, listen with compassion, and get help respectfully.
The first step to checking in with your student is to ask. Ask them how they're doing and get a conversation started. If you're worried about a student, it's really important that you start the conversation even if it feels uncomfortable, especially because you might have been the only one who has noticed something's off. Here's some examples of questions to ask to start the conversation off. You could say, "Tell me about your day," and keep it simple. Or you could say, "I've noticed," and name the things that you've noticed. For example, you've been wearing the same shirt in your last couple of Zoom meetings, or your friends have reached out to me because they're worried about you because you haven't really responded to their texts and you usually respond right away. How are you doing? Once you get the conversation started, you can move on to more serious questions like, are you hurting yourself? And if they say yes, how have you been hurting yourself? Have you taken anything? And then ask, are you thinking about suicide? It's important to ask about suicide specifically rather than keeping it general, like for example asking, do you feel safe? Not everyone who is self-harming is thinking about suicide, and not everyone who is thinking about suicide is self-harming, though self-harm is a big warning sign and definitely something to look out for when you're having this conversation. This is a difficult conversation to have, and asking about suicide can feel upsetting. However, asking is a must, and if you don't feel like you're able to do it, find someone who can as soon as possible. Make sure to ask this question non-judgmentally. You don't want to say, "You're not thinking about suicide, are you?" Be straightforward and be ready to listen, which is the next step that Lizzie will cover.
Once you've started the conversation by asking, the second step is to listen. You'll learn more about what's going on with the student and also show that you care enough to listen. Here are a couple tips on how to listen. Remember, if a young adult is putting their trust in you by talking about something that's going on with them, it's really important to stay non-judgmental and to show that you care. One tip for that is to use open-ended questions. So avoid more questions that could be answered with a yes or a no. If you leave things more open, they have a little more room to steer the conversation where they need it to go. You also want to try to validate a student's concerns before you offer advice. And what we mean by that is kind of letting somebody unload what they're going through before thinking about solutions. And it can be really tempting to offer solutions or ways to help, especially when we care about that person and we think we know how to help. But often if you don't let that student finish first, they feel unheard or like you weren't really listening to them. A good rule of thumb is to spend 80% of your time listening and 20% talking. Remember, your goal is to get as much information as possible. Another thing to keep in mind is that if you have this conversation and it turns out that the student isn't struggling with anything big, you don't want to seem relieved that nothing's going on. That kind of sends the message that if in the future there is something they need to talk to an adult about, they can't bring it to you. You want to ask with curiosity and respond with compassion. Remember, your willingness to listen could start to plant that seed of hope for the student that things are going to be all right. Here are a couple phrases that you might find helpful during the listening phase of this conversation. Rephrasing a student's concerns or checking for understanding are a good way to make sure that you're on the same page and show that you've been actively listening. So you could say something like, "It sounds like," or "It seems like you're dealing with," and rephrase some of the content that you've heard. We're not always used to doing this, but simply stating, "That sounds really hard," or "really frustrating," "You have a lot on your plate right now, and I'm glad that you told me," can be really powerful for a student to hear. Just validate where they're at and that that's a hard place to be. There might also be an opportunity as you're listening to kind of pivot the conversation towards hope. Point out some of the things that a student is already doing to take care of themselves or things that are going well. This can lay the foundation for our next step, which is to partner with that student in getting help.
Lizzie and Shilpa have given you some good pointers on how to ask the question, how to listen to the student's response, and now we want to take that information and get that student some help. So now, how can you best partner with your student and activate the support network? First question to ask your student is, help me to name someone in your support network. Who are the trusted adults that you can go to? Is it your parents? Maybe the parents of a friend? How about a coach? How about a teacher? Are you connected to a school adjustment counselor or a guidance counselor? We want to be sure to follow your school policy and protocols and activate whomever it is in that student support network to help them through this difficult time. Remember, you and your student are in a partnership here. How can you extend help to your student, and still give them some power over where they may feel powerless. One of the best things to say is, I care about you. I want to help you. I want you to stay safe. As Lizzie talked about in the listening part, you want to respond with compassionate responses. Have you been like this before, and what has been helpful? Who else can we talk to about this? Maybe we talk to the school guidance counselor. What is it that we're in agreement that we can do today to best help you? Again, we want to create a narrative of hope, and the student may well feel that they're struggling completely alone. But now you've given the message that you're in it with him, and you want to bring more people in to support that student. We've included for your reference some useful hotlines that you may be able to offer your students. One is the Samaritans statewide hotline. All of the hotlines that we offer are 24 hours a day, 7 days a week. The Samaritans hotline is English speaking only, so be sure that you include that in your notes so that you can give that to students who may need that. For a Spanish speaker, the National Suicide Prevention Line, also 24/7, offers both English and Spanish for anyone who calls. And you don't have to be in total psychiatric crisis to call these lines. You can call if you're worried. One of the hotlines we've included is the crisis text line. This has been shown to work very well with our youth today, who would much prefer to have a conversation through text than to have a telephone conversation with a person. It's been found to be extremely effective. And we've also included a couple of specific hotlines. One is the Steve Fund crisis line for people of color. We've included some hotlines for GLBTQ plus folks, the Trevor Project, and the Trans Lifeline. And we've also included a way to get in touch with your local emergency services program. You would call this number, 877-382-1609, and put your zip code in, and you will be automatically transferred, connected to your local emergency services program. We've also included for your convenience the number to the NAMI Mass Compass Helpline. This is a phone number that will help you to navigate through what can be an overwhelming and confusing mental health system. And they are there to give you education and support you as you get into the mental health system.
Following up is a really important piece of this process, and it's going to look different based on your school's protocol. Checking in is going to look different because you're not able to see your students in the hallway, during classes, or generally in person. We want to acknowledge that technology can be difficult to access for a lot of students and families. If technology is something that you and your student have access to, it can be a great tool to follow up. I'm sure you are all familiar with Zoom. This can be a great way to check in and see your student visually. Texting and phone calls are also a good option, especially texting if your student is in a home environment without much privacy or quiet. Set up a schedule to check in if you can, or set up check-ins with their guidance counselor, school social worker, or other school professional according to your guidelines. It's really important to let students know that you're there and want to be a support for them. Checking in doesn't just have to be for students who are feeling suicidal. This can be for any student who is on your radar. Social connection is a really big protective factor against suicide for students. So arranging that before they may start to struggle more seriously can be an important form of prevention. There are many apps available geared towards mental health. We're going to highlight a few here. Not Okay and My3 notify student support system easily and quickly if they're in crisis and need someone to check on them right away. Headspace and Calm are more geared towards coping skills such as mindfulness and stress relief. Apps can be a very accessible way to cope because many students and families have access to a phone or some sort of technology.
Thank you for joining us today. We hope we've been able to offer you some tips and pointers on how to best help your students. For more information about the NAN Project, please visit our website, thenanproject.org, and for more information on specific mental health resources during this time of COVID-19, please visit us at the nanproject.org/COVID-19 resources. Thanks again.